The COVID-19 pandemic has been a crisis like no other in recent times. Worldwide, the socio-economic impacts have been rapid and hit people hard, affecting us all but not equally. Social protection has been central to the government response in many countries. It has been helping people to manage the economic fallout of the pandemic in their own lives through a combination of social assistance, social insurance, and labor market interventions. Governments have worked to prevent routine social protection programs from collapsing under the strain of increased demand just when people needed support the most. But this was not enough. In many countries, governments also adapted programs and created new ones to increase coverage, reaching more people, particularly those hardest hit. To increase adequacy, providing more support as people's needs grew, and to increase comprehensiveness, addressing new risks such as temporary unemployment, loss of informal income, and increasing levels of gender-based violence. In all this, priorities have been to act fast and to try to include everyone who needed support. Has each country's response been the same? Absolutely not. Responses have been influenced by the funding available, political will, and the strength of existing social protection programs. But strength is not only about programs, it's also about systems. Imagine social protection as a solar system. At the center is the policy architecture, the legal foundation, strategic vision, and fiscal framework that mandate and govern social protection programs. Next is program design, which uses evidence to work out who is entitled to support, the types of benefits and services they can access, and the level, frequency, and duration of support. The outer ring is implementation. All the functions along the delivery chain, from outreach and registration through to monitoring and evaluation. In settings where this system was stronger, parts of it were used and adapted to respond to the COVID-19 crisis. For example, many countries built on existing data and information systems to help reach people in need. Where the system was less strong, in countries just starting to build social protection systems, or where there were gaps in provision, humanitarian actors played an important role connecting functions from their own systems to strengthen and complement weaker elements of social protection. COVID-19 may have been exceptional, but these lessons apply well beyond. All countries experience multiple and overlapping shocks. Some of these are recurrent and predictable. Governments, those of us that advise them, and others funding or working to deliver emergency response can take steps now to prepare for future crises. How can we do this? First, we must strengthen routine systems, reinforcing each and every element so that social protection systems are ready to protect anyone in need throughout their lives. This crisis has reminded us that we are all vulnerable. Second, we must understand what different people need and remove barriers that prevent some people from getting assistance. When the routine system is better at including people, emergency responses that build on that system will be too. Third, we must use a shock lens, making sure a country's social protection system is built upon an understanding of the risks its people face. This may entail many small and simple changes. And fourth, we must coordinate across sectors, ensuring we focus on joint outcomes, work together, and learn from each other to improve preparedness and emergency response. COVID-19 has reinforced what needs to be our collective mantra. Preparedness is essential. We need to act now to prevent future shocks from becoming crises.